Hey guys, welcome to Mad Medicine, where we talk about how men can optimize their health, escape the collapsing U.S. healthcare system. Today's video is a reaction video, but not a reaction to a video. It's actually a reaction to a New York Post article that a patient of mine sent me. Thanks for that. You know who you are. And it's about Matthew Perry. His autopsy was just released, and I was able to obtain a copy of it. It's freely available online. Anyone who wants to look at it can take a look at that. So this article came out in the New York Post yesterday, and this is the title. Matthew Perry was, quote, angry and mean from testosterone shots in the weeks before his death. Autopsy. As if the autopsy determined that he was angry and mean in the weeks before his death. This article is absolutely ridiculous. It's completely absurd. It is written by Catherine Donlevy, who is a young journalist in New York who should know better. This is what I would call yellow journalism. Yellow journalism is a term that hasn't been used that commonly anymore. It's kind of an old-fashioned term, but this is the definition of yellow journalism, if you're interested, from Wikipedia. Yellow journalism and yellow press are American terms for journalism and associated newspapers that present little or no legitimate, well-researched news while instead using eye-catching headlines for increased sales. Hmm. Techniques may include exaggerations of news events, scandal mongering, or sensationalism. By extension, the term yellow journalism is used today as a pejorative to decry any journalism that treats news in an unprofessional or unethical manner. So I think this article absolutely qualifies. So we'll just read the first line here because I'm not going to go through the whole article with you guys, but I do want to unpack this a little bit for you. So Matthew Perry was getting regular injections of testosterone in the weeks leading up to his tragic death, which a friend said left him, quote, angry and mean, according to his autopsy report. The male hormone was just one of many prescriptions in the iconic Friend star had been taking when he accidentally drowned in his hot tub on the 28th of October, including ketamine, which officials ruled as the cause of his death. So, yeah, spoiler alert. I mean, that was the official cause of death, was complications from very high levels of ketamine in his system, in addition to a number of other drugs and a few other issues that I want to touch on briefly. Again, I don't want to make this video about Matthew Perry, and I certainly don't intend to disparage him or bring any additional pain and suffering to his family or loved ones. Just briefly, in his autopsy, like I said, he died of, number one, acute ketamine intoxication. He had levels of ketamine in his system that were the sort of levels that you'd expect with somebody undergoing general anesthesia, right? Incidentally, and this was not a big surprise to me, but he had severe coronary artery disease for a guy of age 54. And he had up to a 75% LAD, left anterior descending artery stenosis. He had a plaque there that was in a very high risk location, and a very severe plaque. And he had multiple other diseased vessels as well. So what that tells me is that, if he hadn't passed away on the 28th of October from this ketamine related issue, I don't know that he would have made it into his 60s without some sort of a coronary event. A 75% LAD lesion is serious stuff. And it's not terribly surprising considering his poor general state of health. He had COPD as well, because he apparently was a smoker. I think he had quit, so good for him. But he also had buprenorphine in his system, which is used to treat opiate addiction. And he had two different benzodiazepines, again, not at toxic levels. So lorazepam and clonazepam, which are, benzodiazepines, I guess benzodiazepines are drugs that are sort of cousins of Valium. That's one that many people are familiar with. They're used to treat anxiety and a number of other conditions as well. So there was some polypharmacy going on. He had a lot of different substances in his system. He apparently had been using ketamine infusions to treat his depression, and it is FDA approved for that indication. There's a nasal version of ketamine, but it has to be used in a monitored setting. You can't just like go home and take it. But this ketamine that was acutely in his system was presumably obtained illicitly, because he was likely taking it at his home, and That's not typically how it's administered, and certainly not in the doses that led to the serum levels that he had. So ketamine, yeah, it actually can be very useful in certain cases for the treatment of PTSD, depression, that sort of thing. Um, I use a ton of ketamine as an emergency medicine physician. It's actually an extremely useful medication. I use it to intubate people. I'll use it for acute severe pain. I'll use it for people who are agitated and combative and out of their mind and a danger to themselves and others. And it has a number of advantages that I'm not going to go into because it's beyond the scope of this video. But the main one being that in typical therapeutic doses, there's a lot of hemodynamic stability with it. So I'm not going to drop their blood pressure. Certainly they can lose their airway, but it's a little bit better than other drugs in terms of maintaining airway reflexes, that sort of thing. It's called a dissociative anesthetic. So what that means in layman's terms is when you give somebody a dose of ketamine, let's say to reduce a wrist fracture, which I do all the time, they look like the lights are on, but nobody's home. So they're just sort of staring off into space, and there's there's this sort of blank look on their face. Short time after that, they kind of start waking up, and there can be something called an emergence phenomenon, which happens every now and then, where people can get really agitated and confused and sometimes even violent as they come out of it. It doesn't happen very often. It's pretty easy to smooth out, and it's mainly with adult males. That's been my experience. Kids don't really have that issue, but ketamine is a wonderfully useful medication. It's obviously extremely dangerous in the wrong hands, but in a monitored setting with a physician who is experienced with its side effects, with its pros, its cons, etc., it's extremely safe. And like I said, you ask any emergency medicine or anesthesiologist, physician out there, and they'll tell you the same thing. Ketamine is it's not a wonder drug, I would say, but it's pretty damn useful. I use it all the time. So did did Matthew Perry's testosterone therapy make him angry and mean? I guess that's what we want to talk about here. So what does the literature say? This is an excellent review article in Andrology. It's a great journal. Testosterone, Mood, Behavior, and Quality of Life. It's from 2020. This is one of like dozens. And if you go to PubMed and you look up depression and mental health effects of testosterone, you're going to find all kinds of literature on this. But this is a really nice review article that summarizes a number of different studies, and we're just going to dive into those here real quick. This is not a deep dive today, guys. So they talk about a number of different psychological effects that testosterone replacement therapy can have in hypogonadal men. And the first one they talk about is a measure of quality of life, which is kind of a nebulous thing, this sort of like improvement in quality of life that's noticed with testosterone therapy. But they define quality of life. They say quality of life is principally the degree to which a person enjoys the possibilities of life based on the categories being, belonging, and becoming, respectively, who one is, how one is connected to one's environment, and whether one achieves one's personal goals, hopes, and aspirations. So there's a number of different tools out there to quantify that. And they quote multiple studies in here. I'll just read one briefly for you guys. It says, a meta-analysis on testosterone replacement therapy in hypogonadal men versus placebo evaluated 23 randomized controlled trials. 21 were placebo-controlled, and they basically said that compared with placebo, treatment with any TRT, topical, injectable, pellets, it didn't matter. Treatment with any TRT significantly improved quality of life. So there seems to be a really significant, at least statistically significant, improvement in quality of life. And I know all you guys out there that are on TRT, you're like, yeah, duh. Of course there is. But it's nice to see this actually in a research setting. And again, in this paper, if you want to get a deep dive on this particular area of testosterone replacement, meaning its treatment in mental health disorders and in mood and cognition, this is a great paper that you can look at. So in terms of depression, there's actually a lot of positive effects with TRT that are well documented in the literature across many studies. So they quote here, they say, the European male aging study demonstrates that depression in its various forms is related to hypogonadism in community-dwelling older men with a potentially causal relationship. Yeah, absolutely. A randomized double-blind placebo-controlled study in 33 hypogonadal men with concomitant subthreshold depression, which is dysthymia or minor depression, investigated the effects of either testosterone gel or placebo Men on TRT had a greater reduction in scores of the Hamilton Rating Scale for depression and had a higher remission rate of subthreshold depression. So yeah, so it improves depression scores in a number of different studies. Again, I'm just quoting you one. We're taking this very superficially today. Okay, what about anxiety? Does it make anxiety better? Well, according to the study here, it says an inverse correlation between symptoms of anxiety assessed with the Hopkins symptoms checklist with total and free testosterone in a population-based sample of 3,413 men was reported. Now, what about aggression? So they said that he was angry. Well, aggression is it sort of depends on the situation. Sometimes aggression is actually appropriate, and many times it's not appropriate. So what we're really looking for is inappropriate aggression. So the literature is a bit nebulous on this, but there's one study that in particular that's interesting. So they said in a placebo-controlled double-blind crossover study using intramuscular injections of testosterone undecanoate, so they used 1,000 milligrams of testosterone undecanoate, followed by a washout period. They found that in response to aggressive provocations, direct aggression increased testosterone dependently, while irritability and assertiveness were not affected. So that's interesting. So, yeah, so in response to direct aggression, these men were able to ramp up their aggression. So that's which is probably an appropriate response, right? You don't want to have people walk all over you in life, and maybe testosterone helps you do that. It's interesting that they said there wasn't any sort of change in assertiveness, which there are studies showing that that's something that actually improves as men become more assertive. And sometimes that's misinterpreted as aggression. If you've been hypogonadal for your entire adult life, then many times the old passive you gives way to somebody who will stick up for themselves a little bit more, be a little bit more assertive. And that can be misinterpreted by the people in your life who are used to you being passive and docile. They could misinterpret that as you being aggressive, or now you're being a dick. Well, you're not being a dick and you're not being aggressive. You're just sticking up for yourself, and you didn't do that before. So you're much more assertive. And that's a positive trait in a man in the vast majority of cases. The other interesting thing about this, I talk a lot about the androgen receptor at times, and this article goes into some really interesting details about that, which I'll just touch on superficially. We know that testosterone levels, according to this study, low testosterone is associated with increased rates of depression, anxiety, etc. Interestingly enough, the more CAG repeats that you have, remember, the more those are those CAG repeats on the gene that encodes for the androgen receptor. The more of those you have, the less sensitive your receptor is. And so, interestingly enough, the more CAG repeats you have, the higher rates of depression. There seems to be an association there. And interestingly enough, men with shorter CAG repeats who then have a more sensitive androgen receptor are less likely to have depression, anxiety, etc., and these associated mental health problems that we've been talking about. So it's interesting. It's not just your testosterone levels, but it's also the genetics of your androgen receptor that may make you either resistant or perhaps a bit more susceptible to depression, anxiety, and these other mood disorders that we've been discussing. So pretty interesting stuff. So this is interesting stuff in the literature, and this correlates quite well actually with what I've seen clinically. It's what I've seen and heard from patients and other physicians that I network with and talk. We all have seen this. We all completely understand. It's really these sort of mental health disorders that we're talking about here, being angry and depressed and irritable, and especially and anxious. These are low testosterone symptoms. These are not high T symptoms. These are low T symptoms. Low T men tend to be irritable, bitchy, moody. They don't feel good. They don't feel good. They tend to have a short fuse. They can't seem to relax. When you treat a man's low testosterone and you get him dialed in, things tend to smooth out a little bit. All right, they're able to handle adversity without getting worked up, without having these over the top emotional responses. Okay, they don't perseverate, they act. They don't second guess themselves. They're more assertive, as I mentioned. And again, that assertiveness can sometimes be misinterpreted as aggression, but it's not. It's not at all. And so it brings out these more masculine psychological traits that perhaps have been dormant for a very long time, and that is almost always a positive thing in a man's life. It just can sometimes take friends and family off guard a little bit as they see these changes, because they can sometimes happen fairly quickly. So, and one of the best things that I've seen, and I know that many of my colleagues feel the same way about this, is the men who are able to come off of psychotropic medications, specifically antidepressants, especially SSRIs, because they probably never needed them in the first place. They were actually just suffering from low testosterone. But when their hypogonadism is corrected, many of these psychological issues will go away, and these men are able to come off of these medications because, as we all know, I mean, they are not without side effects. So, having said that, that article. Is obviously ridiculous. Anyone who knows anything about testosterone knows that it's very unlikely that Matthew Perry's anger and being angry and mean had anything to do with his recently started testosterone therapy. I mean, what would be the probability, right? Like, is it that he was angry and mean because he was having his low testosterone corrected, or was he angry and mean and had mood swings because he had poor health? He was struggling with drug addiction, depression, anxiety, a number of perhaps other mental health conditions, and was on numerous psychoactive medications. I mean, the answer seems pretty obvious to me. It's obviously the testosterone, right? Come on. I mean, that article is it's classic yellow journalism, sensationalism, uh, just there to grab readership, grab attention, and unfortunately, it just perpetuates these myths. I mean, there are probably hundreds of thousands of people that read the New York Post. I don't know why. It's not probably not the most reliable source of information for you to get on a daily basis, but a lot of people do read that, and they'll be like, "Yep, that was it. That's the testosterone doing it, all right." And these myths will just continue. It's classic testosterone phobia. It exists in the media. It exists in the medical world, and as a result, it's going to continue to exist among the large portions of the general public until we get things turned around, until there's enough guys on testosterone and the positive effects are undeniable. So that's all I have for you guys today. I just again came across that today thanks to a patient, and I felt like I had to say something about it, so I couldn't help myself. Let me know what you guys think. I would really like to hear some of your experiences with testosterone, not just from the physical standpoint, but obviously the mental health part of it. I know it has definitely helped my mental health. It has helped my emotional stability, clarity, focus. It's the majority of the benefits that I received from testosterone therapy when I started many, many years ago, as I always say, were above the neck, meaning they were emotional, they were cognitive. I know it has made me a better partner, better father, and just a better man overall. So take care, guys. I will catch you next time. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.